Well, good morning, good afternoon. I'm David Willis, and welcome to our November Willis and Friends. This is actually our sixth session this year, and I'm really thrilled that you've been joining us for these discussions and conversations. Our Early Relational Health Coordinating Center at CSSP, we seek to use these sessions to elevate and communicate innovative, scientifically based, and impactful approaches to advance early relational health in child health transformation and in communities. And I'm always fortunate to have good friends, colleagues, and leaders, thought partners who inspire me that join me in these conversations together. So it's really a thrill today to be talking about partnering with families as key to advancing early relational health. So let me tell you about today's conversation. Our coordinating center really wants to elevate conversations around advancing early relational health, and one of our key strategies has been to advance meaningful, acceptable, and valid approaches to the promotion of early relational health and perhaps measurement, but not simply adopting a screening tool or a simple way of thinking in that way, but rather listening deeply about partnerships with families, sharing together their interests and strengths and capacities, and thinking about how we together can see the strengths and also be thinking about what we can do more to move forward. And within that, is there something we can measure or learn about? Our early relational health initiative strives to be equitable and anti-racist, and we're committed to partnering with families in new ways to develop meaningful approaches that honor and strengthen the foundational relationships that are within all families and in their communities and, of course, in their culture. And along this journey, we've learned a lot about the critical importance of conversations about relational health, about the importance of a family's hopes and dreams that they have, and their strengths and needs as a critical step to really advancing a relational frame and this effort. So I'm really thrilled that I have two national innovators and thought leaders on these topics that have partnered with me. And our work at CSSP about thinking about this space, about meaningful approaches for advancing relational health, measurement, partnering with families, and the like. So let me introduce you to my dear friends. First, Alyssa Ware. Hello, Alyssa.
Hi.
Alyssa and I met, it's been, a number of years ago. I think it was at National Academy of Sciences forum meeting. We sat right next to one another and had a
Absolutely.
good conversation. And since you and I have had the chance to work from the PSP Brain Trust work with our Pediatric Supporting Parents Early Relational Health Promotion, Prevention, and Measurement Work Group. And then we have a number of partnering activities we have now with your role in Family Voices and the Reach on and Read work in this early relational health space. And Alyssa Ware is a associate director of programs and strategies at Family Voices. She received her master's degrees in social work from Catholic U, currently pursuing her PhD in social work at Catholic U, with a research focus on autism diagnoses and treatment within the African American community. And then Jessica Riggs. Hello, Jessica.
Hi, good afternoon.
And great welcome. And Jessica, you and I met through our dear friend Kate Rosenblum at University of Michigan. And you've shared the passion about the work around the early relational health screen that Kate and I really have been on the same journey for a number of years. And now you've joined on board, which is phenomenal. And I know that you've been working to bring video feedback into the healthcare system in that Thrive with Your Baby clinic that we're going to get a chance to talk about, which is thrilling for me. And she's a collaborator at University of Michigan in the Zero to Thrive, that multidisciplinary university-based program focusing on promoting health and resiliency. I know Jessica oversees the evaluations of the infant and early childhood clinic and the research effort. She leads the Thrive with Your Baby clinic, a universal promotion and prevention effort. And then you have research efforts that are really focused on identifying protective factors and building resiliency, all with a relationally focused trauma-informed effort. So I'm really thrilled that we can begin these conversations together. So let's start. Let me have each of you perhaps offer your first opening thoughts and reflections around this experiences along this journey about advancing relational health, especially this partnering with families in new ways, critical importance of conversations, and also thinking about measurement, how it plays within that context. So Alyssa, you want to go first?
Sure. And thank you for having me, David. I'm happy to be here and talk about this important topic. So, as you mentioned, I've had the chance to work with with you and CSSP and other thought partners on early relational health. And what I've found is that parents, providers, and community members all really understand the importance of growth and development in infancy and early childhood, but often are really struggling to understand what is the role of relationships, what does that look like, and especially during this kind of critical period, which can often be challenging, especially when we talk about families. As I've been on this journey to advance early relational health, I've found that partnering with families is essential to really increasing not only awareness and providing education, but also really getting it right, like approaching it in the appropriate ways, right ways that are, culturally sensitive, that really address the needs of what families need in order to really engage in early relational health and improve health outcomes. This is especially true when we talk about families of color, and I really want to raise that up as a part of the work that we've done with PSP, and the Brain Trust. Understanding and addressing really the fundamental lack of trust and challenges with relationships, that families often experience with the healthcare system can really impact the promotion of early relational health, and taking in that knowledge and that information, right? If families do not trust the source of the information, where do we go from there? What do we do? How do we build that trust? And really, what do families need to see? What do they need to feel? What do they need to experience in order to foster that relationship with providers that will allow them to feel safe and open to hear and understand how they can partner with the provider to promote optimal health for their child across the lifespan, right? And so that gets to the part about partnering with families. That becomes really the critical and kind of the impetus to saying, how do we get this right? How do we help families feel heard, feel trusted, don't feel judged, et cetera? And so partnering with families has, what we found is, it's really uncovered that to get to those relationships and really build that trust, they need providers to talk to them
Hmm.
and with them, not at them, right? And
Right.
that becomes really important. Also, really ensuring that we are engaging in ways that really demonstrate, an anti-racist, culturally appropriate framework, that's essential to building that trust and relationship. And that becomes the bedrock to then promote and continue to advance early relational health. I'll just share briefly, my own experience as a parent. And really, that relationship that I was able to foster and develop at a very early age with my daughter's pediatrician really lent itself to some tough conversations that had to happen over the years. And what's my role as a parent? How do I operate? But all of that within the context of my mother played a huge role in my daughter's life. My grandmother played a huge role in my daughter's life. And how do I integrate all the knowledge that I have from them and the provider, right? And that provider honors those relationships, while I can also say that they are also an expert on their information. And so bringing all of those pieces really help to facilitate the outcomes and relational aspects that I've experienced both as a parent and then seeing as a professional within this space.
The personal experience of relationships with not only within your family, but also with the care providers really is essential. And then the journey you and I are having about how do we bring family voice and partnership and trust building relationships between clinicians and families is really the journey that's really exciting for us to keep talking about. So thank you for getting us started. Jessica, let me
Absolutely.
turn to you. What are your first thoughts about this relational health space and your journey and discovery, and thoughts about partnering with families in the work that you've been doing?
Yeah, absolutely. Well, I want to echo so much of what you said, Elisa. I think like it's just so important to start from a foundation of meeting the families where they are. So I've been really lucky to be able to do early relational health work through screenings and other supports in a number of different settings here at the University of Michigan. So we've implemented clinics to sort of support relational health in our psychiatry department through the perinatal clinic. and our infant and early childhood clinic. And we've also implemented this in pediatrics offices, and we've utilized this in home-based, home visiting work as well. And the exciting thing is across all those settings, it's working and it's effective, which is pretty phenomenal. But I think the piece that makes this early relational health work feel so different than the other screenings and other evaluation work that I do in my department is the opportunity to sit with a family and reflect with them on the interaction. And so we do this through video review, where we'll just take a very quick snapshot of a relational interaction between the parent and the infant or toddler, and we'll watch parts of it back together. And through that, I get to understand better what I saw between the two of them. I get to understand what are the pieces the family brought in with them today. Was this child sleepy, groggy, fighting off a cold? Did mom not sleep last night? Is mom sleepy, groggy, or fighting off a cold, right? Is this little one teething? Did something happen in their community that was different? Did something happen on their ride into the clinic that's different, right? These are all really important things that I can understand the lens of what I'm seeing through. But also really important is just reflecting with the parent. How does it feel in this moment when you're watching that relationship on video together and we are watching it together? What are you thinking and feeling when we're watching this clip together? What do you think your child is thinking and feeling? And that space for that reflective capacity and that reflective practice, I think one is really important in bringing me as a provider closer to understanding this family and really having a better chance of getting it right with them and understanding all the things that are coming into the room with them. It also is something that parents don't get the opportunity to do a lot. As a parent, a lot of your day feels like you are reacting in the moment to whatever's going on without the opportunity to sit back and reflect on all the different behaviors that are happening. So in those moments, we really get to look past the behaviors and talk about the why underneath the behaviors. And I think that promotes connection and understanding within the family. And as a provider, it's not something I get access to quickly in the same way that I do with these early relational health screening pieces, which is really exciting. So within these conversations, I get a better understanding of the parent's perspective, really opens the door for sharing and understanding. And we're through video review, we're looking at the same thing. So there's not that miscommunication of what I'm trying to describe happened or what they're trying to describe happened. We're looking at it together, and it kind of cuts through the conversation in a way that I think gets us to the heart of the conversation faster. And equally important, I'm sort of able to wonder with the parent about whether their child's thinking or feeling something different than that parent maybe originally thought of. And it's really a wondering. It's not an assumption. It's not assuming I'm right. I'm wrong a lot in what I'm wondering with families, and that's okay. But to sort of have that space to say, like, I can understand why you think that. I see some of that too. I wonder if he or she's also feeling this way or thinking this. And that, I think, is a way to sort of increase some flexibility in thinking about relationships and really bring that to the center of the focus of the conversation with families.
Jessica, that's really phenomenal. I know that you and Kate have begun offering the opportunity for families to, let's make a movie within the Thrive With Your Baby clinics. This is something families get, I believe, a call before their well child visit, offering that opportunity. And I think you've shared with me that almost 75 to 78% of families choose to come in early to do so, which tells us something really important. And what I'm wondering, Jessica, how do you explain to the family why you're doing this little videotaping, and how do you have it not feel threatening or judgmental, but rather partnering? How do you discuss this with families at the very start?
Yeah, I think that's the key to it, right? And we've had some of the questions within the department and sort of the administrative and mechanism pieces of it is, how do we offer this without making it sound like we think there's something wrong with the relationship, right? Which is a message families are going to hear differently depending on that family's background and depending on, I'm a white provider reaching out to these families. And so there's a lot that comes with that for other families too. So there's kind of, I think, two important pieces to this. So one is we make it really clear this is universally offered. And we couch this understanding of relational health screening as part of the well child visit, as part of the standard of care. In the same way that we're going to weigh and measure your baby and, listen to their heartbeat and get them their vaccinations when the schedule comes up, we're going to talk about the relationship because your child's whole world is through the relationship that they have with you. And so we really, we do our best to offer it to everybody so that there isn't this sort of like biased way that we're rolling it out. The other, I think, really important piece here is that we do these relational health screenings sometimes with families with a lot of, I don't want to say like indicators of risk, right? But families that have been like intentionally marginalized and intentionally divested in because of race, ethnicity, language of origin, country of origin, all of these pieces. And we also do these screenings with families where there's higher rates of like maternal depression, PTSD, anxiety, intergenerational trauma. And even when I can look at the background of a family and assume we might see some markers here of worse relational health because of all these stressors, that is not necessarily predicting what I'm seeing. We see lots of families with a lot of difficulties that they're managing, where that relational health that I'm seeing is such a shining strength for the family. And it's important to screen, but it's also important to promote the things that are going well, despite all of these other aspects of life that are harder and more difficult, and to really call out and acknowledge the places where this family has a strength. And then to also have the conversation of how are you doing this despite other barriers? Where are the places that I can help and advocate for you as a provider to help this grow, this beautiful relationship that you have with your child, and help dismantle barriers that are coming up for you and your family, and starting that relationship at an early age so I can be a person they come back to when their little one enters the school system or, develops mental health symptoms or physical health symptoms, that I'm a trusted source who saw them at their best. And I think that that's an important piece as well. We're not just looking for people to be not doing well. We're looking to promote and help people thrive.
I heard in some of the conversational style after a video is made that one of the first questions often shared with the family is, what do you see as the sweetest moment?
Mm-hmm.
Emphasizing the beauty and the strength in the moment with families. And I also, Jessica, you alluded to everything we think about in terms of relational health is not about fixing broken people, but working to fix the systems that make it hard for families to be in those powerful, critical, meaningful relationships that matter to them every day. And we're very mindful of that kind of effort. Lisa, we've talked a lot in some of the tables that you and I have been at about this whole concept of measurement. And it's a slippery, vulnerable, tight spot that has necessities on one hand in a dominant way, the way the culture works, but more importantly, is really can be a barrier, if not a vulnerability or a misstep in partnering with families. And yet, how do we think about how families think in this way? What are your thoughts? You want to share some of your ideas, please?
Sure. So, I think what we've heard from families as we've done this work, as we had these conversations, is families approach measurement as here's an opportunity for me to fail, right? Like here's another thing you're gonna tell me I'm doing it wrong. You're gonna tell me I got it wrong. That's the concern immediately, right? When a particular family that I had worked with actually said, when families walk through into a doctor's office, they're already feeling like they're on display and that judgment is a natural part of that visit, right? This is what I'm here for them to tell me what did I get right? What did I get wrong? Why else would we be here? And that it extended beyond just the provider to office staff, to nurses, to the actual provider. And so when we talk about measurement, it's important to take that into context. Um, Families also said that they know that now, someone is looking at how they make eye contact. When we talk about early relational health, how do I make eye contact? How do they talk to their child? How do they relate to their child? They are left feeling exactly what you said, David, right? Vulnerable, exposed, and potentially judged, right? So it's important to really partner with them. And Jessica, I love the way that you really laid out, it starts with how we're asking questions. It starts with how we're engaging. What do you see? This is what I see. Let's find some common ground and understanding so that we're on the same page. And also pointing out, like, you're really doing these things well. You're working hard for your kid. You're doing great work. And these are some other areas, right? In order to help them feel that the process is transparent, that it's welcoming, that it's educational, that ultimately it's non-judgmental. And as I said earlier, that it's really taking also their cultural understandings and beliefs and conceptualizations into how they're parenting their child. And that's going to help decrease some of those feelings of judgment and allow screening and measurement to really do what it's supposed to, which is to really help enhance and further the great things that parents are already doing.
Lisa, that's really, really wonderful. And are you seeing situations where in the journeys you're in now and the conversations you're in, are you seeing some changes about how practices or clinical activities are moving in support of these strong relational promotion efforts? What do you think? What are you seeing? What are you thinking about?
I definitely see, we hear both. We hear that there are definitely families that are experiencing more of those conversations, more opportunities to build and establish those relationships, to feel like my provider is the person that I'm going to go to. I have an opportunity to call the office, or say, this is what I'm worried about, this is what I'm concerned about, and they are that source of support and information to really help promote their relationship with their child's health development, etc. On the other side, and I just to be really frank and really honest, right? On the other side, we hear that the more that we see some of these kind of mega practices, academic institutions where I don't even know who my provider is seeing, that provider might change every time I walk through the door. So I'm not able to really foster some of those relationships and really have those conversations. So I'm kind of going in, I'm feeling like, it's a little bit of a checkbox. They're doing these screenings. I'm not always really understanding, what is the purpose of this? What are you asking me? And what are you doing with this information, and what should I do with it? So we see that there's some movement, because we used to hear all on one side, right? But we know that there's still a lot of work to be done around taking the time, building some of those relationships, having those tough conversations, and really giving that feedback loop to families to say, we hear you, and we're responding, and we're changing how we're approaching this, the conversations that we're having, in order to help you feel heard, to help you feel like we are a partner in this with you, instead of you're just a receiver of information from us, right? And that becomes important to this process.
This is such a strong point, and you know, every clinical service, be that home visiting or um, pediatrics child health care,
Mhm.
the way that the clinicians is present with families and the kind of parallel process of the relationship that they build matters to all of this work. And I hear, as you, all layers. You can have the technical abilities and no relational ability, or you can have a really strong relational experience with families that they just love and adore. And it's meaningful to growth because that sense of being heard, being seen, being acknowledged, being valued, being affirmed, being encouraged is really can be, and should be, I believe, a part of the process of partnering with any families that we deal with. Jessica, what are you seeing in the clinic? the Thrive with Your Baby clinics are, if you could talk a little more specifically about how it works and how it sits in the clinic flow, and what's being witnessed as to what happens to the whole team and perhaps the whole clinic itself when you take that kind of relational health promotion stance. Maybe if you could talk a little bit about that.
Yeah, absolutely. And the answer to that question is it's different in different parts of our clinic. And so we have some subclinics at the University of Michigan where this has been a core component to what we've been doing since the inception. So our infant and early childhood clinic has always included video review and really thinking about if a young child is coming in as a potential patient into this system that we can't understand the symptoms and behaviors that we are trying to label with a diagnosis without understanding the relationship. And so in that clinic, the workflow is that whenever we see a new family coming into the clinic who is age 6 or younger, we see them in our infant early childhood clinic. And that intake process consists of 2 visits at once. So for the family, it's 1, but we're billing it as 2, which is a piece that makes it sustainable for our health system. So we have an intake where we're doing an interview with the parent to understand what's bringing them in and doing sort of your standard classic assessment and interview. And then we have a second appointment that's considered a return visit, where we're evaluating the child in the context of the relationship. So that's where we're doing things like doing an early relational health screen and seeing what that relationship looks like. We're including some potential stressors to the relationship, asking these little kiddos to clean up the fun toys that we're providing for them can be a stressor, some teaching tasks. We do some language assessment. And for some kids, that might also include a social emotional assessment, looking at something like autism or developmental delay or something like that as well, kind of as needed to give a comprehensive picture. And then the feedback is centered around reviewing video clips together while talking about what our interdisciplinary team thinks about in terms of diagnosis, but most importantly, next steps and how can we connect the family to services that will help them with whatever problem brought them into our clinic. And so we're really focused on promoting parenting strengths and helping parents see things they're doing well in the interaction and maybe things that there are barriers around in their day-to-day life, and we can help them problem solve around how can we do this more. We also watch clips of challenges together because they came to us because they said this was hard, this is a problem. And we want to be able to say, we hear you, we see you, we believe you. This is a hard thing. But let's think together about how to address it. And then we always promote the relationship. What are those moments of connection, shared laughter, joy, hugs, cuddles, inside jokes? Some of my favorite clips are when there's 2 parents and the little kiddo says something and both parents crack up and we have no idea why, but it's because it's an inside joke in that family. It's meaningful to them. And that helps me understand that family and how their life is day to day so much better than a standard symptom screen is ever going to help me understand that family. And so in that way, the clinic flow works well. It takes a lot of resources. We're able to recoup money from our insurance systems that we work within in a way that makes it sustainable. And we're really able to train providers across disciplines, psychology, psychiatry, social work, nursing, MAs to be part of this work and to help keep eyes on. So in that way, it's working well. Now, in other ways, we're just starting this out, right? We're just starting to implement this on the adult side in our perinatal clinic. And it feels a little bit like we have to kind of think, how can we reinvent the wheel to take an adult focused provider who's talking to a new mom with a young baby and help them understand the importance of, yes, screening her depression symptoms, making sure she's on appropriate medications for breastfeeding, but also checking in on how that relationship's going and really thinking about it from a 2-generational approach. And so we're doing some collaborations across our perinatal and infant early childhood clinic and bridging services in that way and kind of breaking down this artificial barrier we have at our academic institution between adult services and child services and really thinking about it as a family service. So, You can talk to me in a few months about how it's going. We're just getting it rolling, but I feel really optimistic about it. There's a lot of support for it. People are recognizing that it feels like a gap in what we're doing by not addressing this relationship.
So you're talking about the, sort of especially the evaluative clinic process that is taking a deep relational view in the work that you're doing that's strength-based and focused, but also evaluating when necessary, as well as what you're going to do. But I'm also struck with bringing the relational health frame into the perinatal space and pushing on de-siloing maternity care and infant care into that perinatal relational health space, which is really where families actually live, where culture really has always known. And we've always known that there's something very sacred about that perinatal space and the relationship between, and making that really intentional and visible. I'm curious, Jessica, what are the reactions of the psychiatrists and the OBs and the residents as they have to react to your bringing present? Relationships here really, really matter. What are you witnessing? Because it's a paradigm shift. It's you're knocking on the door of change, and it's good. But what are you seeing?
I'd say overall, it has felt like I'm knocking on the door and someone's excited to answer it. I guess I'll say it that way. There is a feeling that, and to take a step back, I think to introduce this paradigm shift, you have to do it within the context of a relationship. And so I've worked within the perinatal clinic for over a year. I've learned how the clinic works. I've learned who the providers are, what their background is, what their strengths are, things that I can't do well and don't do well, that the rest of the team does a phenomenal job at. And so I think in rolling it out, you're better able to fit it into the system in a way that doesn't feel like a paradigm shift. It feels like a complement to what's already being done. But through those conversations and having it be a standard part of care that patients will receive in the clinic, it will increasingly become part of the conversation when we're engaging in case disposition and all of these very medical siloed conversations, right? What about the baby? How's that baby doing? What's going on? How are these things exacerbated by or reduced by moments of connection with mom, with her baby? And so implementing a universal screen there, I think, is making it part of the common language and demystifying it for providers. But I do think this is something that is best addressed early on in education. We have to think about, in the same way that providers learn about, the psyche and behavioral paradigms and biological systems and brain behavior activity, we need to talk about relationships at an educational level to equip people to be more comfortable having these conversations.
Even yesterday, I heard a comment about there's physical health, developmental health, and relational health. And the relational health is a vital sign, too, in child health, in healthcare, in certainly child healthcare. Alyssa, that reminds me of some of the conversation you and I have been having recently about parent voice into transformational efforts, and then parent leadership development, and how we actually help bring into be the training or to clinical services or to practices the experience of families in shared communications. I wonder if you could think with us about what your good thoughts are about engaging families, family leadership for the purpose of creating stronger relationships in the supportive programs and services that are meaningful.
Sure. So first, before I get to that important question, I wanted to just respond to something that Jessica said. And I think what you're doing and the work that you're doing, when I think about it from a family perspective, is the way the system is set up right now, right? A woman has a baby, that's a whole separate thing from what's happening with your baby in healthcare, right? Everything is separate. And what that says to a family is like, my health is separate from my baby's health, right? Those are two very different things. And I think I see the opportunity to set up the model of everything that I do, what's happening with me impacts my baby, and what's happening with my baby impacts me, right? We're creating that model for families to say, you're already interconnected. And not only do we see that and we're going to promote that, we're promoting it in providers coming together in the same space to say, what's happening with you, it also matters what's happening with the baby, right? And vice versa. And I think that's so critical to, like I said, really get that mindset uh, clear from the onset, right? When you're first having the baby, that we are interconnected. Our healthcare is interconnected. Everything that happens to one really impacts the other, and that relationship is so critical. So I just that came up for me as you were
Well,
explaining.
and Lisa, the science is there, the synchrony, the physiological synchrony of, around birth, around that breastfeeding, around those first hours, around the shared emotional connections that happen so early is bidirectional. It's beneficial for the mother, it's beneficial for the father, it's beneficial for the baby. We have all that growing, amazing physiology of looking at MRIs, looking at epigenetics, looking at the physiology that goes on in the stress systems for the two members of the dyad. You're exactly right. And we've artificially always had that separated. So the excitement that I'm hearing as Jessica's speaking and Alyssa, which making me think about, is the science of relational health says that the relationship is good for both. And I would argue good for all. And so,
Absolutely.
whereas that separation artificially is actually really problematic at so many levels and disrupts health and well-being at so many levels that we can talk about. But I interrupted you. So,
No worries. So back to your important question about then how do we bring families into this, right? How do we partner with them in a meaningful way? And what are those approaches that are really going to foster this approach within in the healthcare system, whether home visiting, the pediatric care, et cetera. First of all, I want to say I think it's important to ensure, and I just want to place at the outset, it's important to partner with diverse families, right? You want families that are representative of the community in which that you're trying to engage. That becomes important to helping establish that trust. And Jessica, I think you even alluded to that a little bit earlier. And then looking at this co-development process, right? That everybody brings something to the table to really help develop your workflows, develop the scripts that your staff may use. Jessica, I think you talked about, like, there's a call that's happening to invite them to this visit. What's the language that you're using? Developing that with families to make sure that the language is appropriate, it lands well with families, they feel like that they can be receptive to it, and that's going to be needed in order to really begin that process and advance early relational health within your practice. I think the other piece is that it's essential that you approach this as an iterative process, right? So it's not just we have this, we've laid it out, okay, we're done, here's our protocol. But continuing to hear from families and make sure that you're getting that continuous feedback from the families that you're working with and adjusting your protocols and actions to ensure that you're really operating from an anti-racist, equitable, and strength-based approach, right? Are you really doing that? How is it landing with families? We can think that we're doing it right, but really getting that feedback from families to say, how did this work for you? Did you walk away after we had these conversations feeling empowered, feeling like, we co-developed something and work together to problem solve? And if not, what can we do better, right? Really asking those questions and being curious about that. I also think it's important to expand your definition of family. I think in this environment, that becomes really important, especially in minoritized communities. Families look different now, and staff need to be open to who is that, who is in front of me. We work with a dad on the brain trust, and he often talks about feeling dismissed, when he goes into the space in the, like, oh, well, tell mom. Well, when mom comes in, right, and he's like, no, I have this relationship with my child, right, and so really working hard to define, and broaden the family, as I stated in my own story, right, looking at that multi-generational approach, so that when you're engaging families and you're bringing them to the table, you're looking at different family structures that are represented, so that you're developing workflows, you're developing models and scripts that are going to fit all the families that might walk through your system, and not just from a kind of a dominant lens of how we've defined family in the past. And that makes it, when, especially if, as you're taking this universal approach, it's going to allow things to land better with more people. And I think that that becomes important in engaging and making sure that you're getting that authentic voice in your work.
Lisa, that's really phenomenal. I wonder if I could press you a little bit about, and yet, what are your cautions?
Mm.
Now, we've all seen, white dominant culture, racist child healthcare often wants to screen for everything, which makes all kinds of assumptions, and the whole judgment process is involved, and there's a pressure on advancing early relational health to get measurement going, right? And as if it could be a one and done,
Mhm.
and that makes me nervous. And I'm wondering what your thoughts are about cautions and barriers we got to watch out for, and how to be intentional about
Yeah.
maintaining our anti-racist and equitable approaches to all of this work. What are your cautions and what are your recommendations?
Sure. So, I think I have a few. There are certainly landmines, right? I mean, and and some barriers, right? That can happen in this space, right? People are sensitive. They want to get this right. They're nervous. They know, this is a high stakes situation for families, right? Like, I need to get this right. I want my kid to be healthy. I want them to grow. I want them to develop. That's what I haven't seen a family yet that doesn't want that for their little one. And so, but what I see, and some of the concern that we hear from families that, I feel it, myself, both personally and professionally, are, one, the concern about developing a prescriptive approach, right? That we are taking the stance of, every time a family's coming in front of me, this is a new experience. There isn't one way to do this. There isn't one outcome or thing that we're looking for that is going to look exactly the same every family that sits in front of us. And so, I think a caution to take is to really be conscious about not developing a real prescriptive approach that defines how a relationship between a parent and a child should look. That's really, and I want to call it out, that's often rooted in kind of structural racist ideas and dominant culture ways of navigating parenthood. And so I think that in order to do that, making the relationship and the conversation, putting that at the center of how you're engaging in this, right? It's not developing a paper screener where I'm just checking this off. Okay, well, the they'll see you up front to make your next appointment, right? Putting that conversation at the center of this, approaching it as a listener, as a learner, is going to help to decrease some of that prescriptive nature that can happen within, especially when you're moving quick. Um, I think the other piece going into moving quick is that it takes time. That having the necessary conversations, we hear this all the time, and David, you know this from all the work groups we sat on, time. Right? The families in a rush, the providers are in a rush. Everybody wants, like, it's quick, it's fast moving. And how do we take the amount of time we have and have those critical conversations that are meaningful, right? I think that becomes, the goal. How do you listen and hear and get to the heart of what the concerns are? I love as Jessica was describing, kind of this two appointment approach where you're really building out that time to have those conversations, because I think time is needed, but time is also, a challenge that and a barrier that we often see within the healthcare setting. The final piece that I'll just say is that judgments will be made about parents, and that a caution or a concern is that judgments will be made about parents and ultimately the childhood outcomes based on kind of that current interaction what's happening, kind of some of what we see happening like with ACEs, like, oh, here's this, they've had these things. This is what it means it's going to happen to them, right? This is their outcome that they're going to have, without really focusing on one, the role of the resilience and strength of those families, and how do you cultivate that and help, because no parent child relationship is perfect, that doesn't exist, right? And so how do you raise that up and have those conversations to say, this is what you already have and this is what you're working and doing really well, and how do we build on that? And so not being making it where we've already decided what the outcome of this child is going to be. And I think that that's a caution that I just encourage people to keep at the forefront of their minds.
Lisa, I so agree. You're bringing all kinds of reflections into my mind. And one is, in all my clinical years of being with families, the stance that I had with families was in the beauty of the moment and the opportunity of hope within them,
Mm-hmm.
and the desire that the heart of every family wishes for each other, and for that love they have for the hopes of themselves and their future baby. And that gets lost sometimes in the day-to-day life, or in the craziness of the thousand things that has to be done. But those few moments of authentic meeting one another, those moments of eye contact and smile, that moment of recognizing the beauty that this family has together in face of the challenges of everyday life, or the challenges of a new diagnosis, or the challenges of just getting to the office, there are still moments of opportunity and growth that are deeply relational and meaning in this world that is far too focused on purpose and loses the track of being connected, is in and of itself a value and probably a protector against so much of what is hard in our world itself. So it makes me think about how we, as any clinician or any person is with other people, has so much to do with our own heart and mindset. How do we meet people authentically and value who they are, no matter whatever their circumstance, with that wonder of being together, which has tremendous opportunity. And I think you're making me think a lot about that. Jessica, to you, in your work, what are the cautions that come to mind, or that you're witnessing, that you got to wrestle with in trying to advance, again, the relational health framing, what you know from all that you're learning and witnessing and seeing, yet what cautions are you experiencing or thinking about or reflecting on?
Yeah, so I think a lot of the things I'm keeping in the front of my mind are a lot of the things that you all have been talking about already, is sort of how to fit this into someone else's practice, how to train the workforce to do this in a way that really starts by helping them really internalize, believe, and value that this is not, Elisa, like you were saying, a box I need to check, a thing I have to write up for my note that my supervisor is looking for, or any of those pieces, but that the beauty is in the relational conversation and thinking of it as an intervention and a prevention strategy, and not just a screener or an assessment, right? And that we, Elisa, you mentioned sort of the deterministic way we think about things like ACEs. And it's true, but we have some exciting data we're getting ready to disseminate that shows, yes, parents with higher ACEs might have harder times with some of these things. But when we provide them a relational intervention where they get to connect with and partner with a provider to understand their history and how it's impacting their parenting, and to think about their child in a way that's maybe different than how someone thought of them when they were a child, we're not seeing those deterministic outcomes. We're actually seeing the opportunity for so much strength and growth that those parents who have those hard histories, who are also getting the support of that relationship, are quote unquote outperforming other parents without those backgrounds when it comes to relational health. So we can't think of it as something we have to fit in and get done and check a box. We have to think of it as the relational piece, that parallel process, how I connect with the family is going to inform how that family connects with one another, in the same way that my relationship with that family is influenced by how I see them connecting with one another. And that's where like the magic is, right? And that's where our opportunity to push back against and provide buffers, help families provide buffers for these things we can't undo or take away, is housed. And so I think we have to think of it not as a screening movement, but as a relationship movement that maybe is sometimes data driven, but the family's opinions are just as important data as what I'm writing down on my little scorecard or what I'm thinking about, right?
That's so important. I have so many thoughts again. One is the magic of the moment.
Yes.
And that's real. And there's actually some science around that that's growing to our knowledge. But it makes me think of the magic of those positive childhood experiences, the positive relationship experiences, the presence of connection counters or mitigates stress. This goes to what Andy Garner says, who wrote the AAP policy statement. He says, preventing toxic stress and promoting relational health are two sides of the same coin. And within that's that magic of relationship protection. And it also counters so much of our cultural isolation and our culture's focus on the individual rather than the collectivity of being connected. And that is so much of what we're talking about here, the beauty of the relational healing, the relational building, the promotion and prevention effort that's captured in a relational health space. It's really an interesting movement that we're in that has far meaningful efforts. And don't you think our African American communities, our traditional communities, our indigenous communities have been saying that all along? It's just the white dominant structures have dismantled those processes and not allowed for the growth and development of people being connected, because we've broken a lot of those natural healing protective forces in place. That's changing, thank goodness, and it has to. So that begins to, as we've got about another 8 to 9 minutes here, I want each of you to imagine, well, two things. One, what's exciting you right now in both your work, what you're witnessing, and then also, how is that taking on you on what your own thoughts on the journey of where are we going to be in 5 years? If you get what you wish, what excites you, what you're seeing, what excites you, and where do you think we're going to end up being in about 5 years? That kind of thinking. Jessica, can I come to you first?
Sure. Yeah. My hope, my magic wand wish for 5 years from now is that we are able to provide the structural support for diverse providers, diverse in background and diverse in discipline, to feel comfortable implementing these strategies and to push for and advocate for billing structures that allow it to be sustainable. I think healthcare is really siloed among disciplines, and when we stay siloed, we allow sort of insurance companies to dictate what's possible instead of having providers dictate to the insurance company what needs to be the appropriate evidence-based response to something. So I'm hoping for a lot more collaboration. What would really excite me is to find a way to partner with families who have experienced these screens and bring those parents in to also be not just part of the conversation, but part of the team that's doing these screens and having these conversations with families, right? And to say, when my child was born, this is what we did. This is how it impacted me. This is how it was helpful. I can bring those experiences in and help this team of providers think about how to do this better. And I might be the best person to do it. And to sort of have this very family-focused approach where we're giving voice to the people that deserve to be listened to.
Beautiful. It makes me think of peer counselors. It makes me think of community workers or navigators or support people out of the community. Things you think of the dual movement. It makes me think of the partnering authentically with family experiences shared with other families. It makes me think multi-generationally. So I'm right with you, Jessica, and that kind of, and it's, we're seeing little glimmers of that moving forward. Well, Lisa, I'm coming to you for the same question. What excites you, and where do you imagine we're going to be in 5 years? or where you want us to be in 5 years.
Where do so I think we have a common shared vision here, right? Like I think of family, truly family centered. I think we've been trying to get there for a number of decades even, right? A truly family centered approach to this, where as you said, Jessica, families are not just, we're giving them surveys, we're engaging them. Okay, we might have, we might have built some relationships with them, but also we're building relationships at all levels. They're involved in the treatment team. I remember being a parent partner in a pediatric practice, right? But it had to end because it was grant funded. So seeing that, and my hope is, and it happens in 5 years, that is the norm, and not a one-off with a grant, et cetera, that really helps to drive this work forward, and helps families understand kind of because I think that helps cultivate that trust piece that we're talking about, right? Here's someone that's been through it, that's walked the walk, that's gone through it, and they're here to tell me all about it, and help me navigate and build that trust as well. And I think that that's essential to this work, because that leads me to what excites me, what keeps me inspired about this and moving forward towards that North Star, is that families ultimately want what is best for their children, right? They want a system that is going to serve them well, where they feel heard and they feel accepted, and they want to be a part of this conversation. And I see a movement where providers are wanting that and are seeking out the how, because I think providers have wanted that for a while, but seeking out the how of bringing those families in to say, how do we get this right? And that promise and that hope excites me, because the outcome and the ultimate long-term effects of this work is tremendous, and we can see children and families beginning to thrive in a way that we haven't always seen before. And so that continues to keep me excited and engaged and hopeful that we are going to reach the North Star of this being universal, of families being at the center of it, being partners in this work, and moving it forward to really build a system for especially early childhood.
Lisa, that's certainly our co-developed North Star.
Mm-hmm.
That sense, as our title of today is Partnering with Families, and co-developing with families this relational health movement, and learning together how to have that be meaningful. And you've shared with me, and so many others have, that relational health matters to everyone. And how do we partner with families and finding new ways to do it right, that are anti-racist, that are equitable, that are most of all meaningful, and then impactful, to help families move from the challenges that they all know about that hurts them, to the opportunities that, supported by many, can assure for them a sense of well-being from wherever they've come. And this Build Back moment, I'm deeply hopeful for, and yet we can't screw it up by not really partnering deeply with listening authentically with families. And I'm thankful today for having the chance to talk together, to listen to one another. Dr. Jessica Riggs, I'm thrilled about the work that's going on in Michigan with your Thrive with Your Baby clinics, and the research work that's rigorous behind it, that's really helping us know that this matters on one hand. And then, Elisa, you and our partnership with Family Voices and all the other work we're doing about really co-developing the partnership and the learning from families with families along this journey of advancing relational health. It's really to be continued, and it's really thrilling for us. So thanks to both of you for the conversation today. And just foreshadowing for December, we will meet in December. It'll be December 15th, 2 o'clock Eastern, 11 o'clock Pacific. And I'm excited that we'll be talking, topic will be transforming health systems to ensure maternal well-being and early relational health. And we'll be honored to have Governor John Kitzhaber from Oregon, Karen Howard, and Kay Johnson in a lively conversation around this moment of transformational space, but also policy movement space. So thank you all for listening in. I wish you a good Thanksgiving. And again, thanks to my two good friends for spending this hour with me. Be well.
Thank you.
Thank you.